Step 32, surgical sperm retrieval. If there isn't any sperm in the ejaculate, then you need to retrieve sperm directly from the testes. So that's called surgical sperm retrieval. There are 4 methods for sperm retrieval: PISA, TISA, TZ, and micro-TZ. You will get admitted for surgical sperm retrieval normally on the day when your partner will have a collection. At admission, you will see these 3 professionals: your fertility specialist, your embryologist, and your anesthetist. So they check your ID and they check that you followed fasting instructions. They check your medical history. Then they consent you for the procedure. They will explain the procedure, possible risks and benefits and complications. Then you will move to operating theater. Then you will have one of these 4 procedures. I will explain the difference. Testis has 2 units. One is a production unit, actual testis, and the second is a storage unit. That's called epididymis, where all the produced sperm gets stored. So if you use aspiration of the sperm with a needle from the storage unit, which is epididymis, that's called PISA. If you do aspiration with a needle from the testis directly, that's called TISA. These 2 procedures doesn't involve any cutting. It's very simple and they're very, very effective procedures. In some patients, when PISA and TISA fails, they need to have open procedures. A TZ is an open procedure where you have a cut on scrotum, then tubules directly taken from the testis. The next procedure is exactly the same as a TZ open procedure, but under microscope. Under microscope, your fertility specialist can visualize tubules and they will select tubules which looks like contain sperm directly. These things can be done in the one stage where you do PISA, TISA. If you can't get the sperm, then move to do TISA or micro-TZ, or can be done in 2 different stages. You do PISA, TISA. If you can't get sperm, then in future date, then you can do TZ or micro-TZ procedure. The difference is if you do just aspiration, which is PISA or TISA, then you have a much faster recovery. And generally, the PISA and TISA is very, very effective. Most patients with azoospermia do not need TZ or micro-TZ. You will be moved to the recovery. The whole procedure takes approximately half an hour. Then you will be moved to the recovery, and you recover and you will be observed. Then you will see fertility specialists who will explain how successful the procedure was. Then your sperm will be sent to the lab. Very importantly, the sperm will be used to fertilize eggs on the day if your partner is having a collection procedure, and very importantly, extra sperm should be frozen in the future date. In case this cycle is not successful, then you don't need to have these procedures repeatedly. Then sperm can be stored in multiple straws. Usually 1 or 2 straws is enough for one IVF cycle. If you have 5-6 straws of sperm stored, then a very good chance that you have sufficient amount of sperm to achieve your goal of having a child. If not, then you can have a repeated procedure in the future. That is surgical sperm retrieval.